possible. My protocol has shifted and changed as I follow certain other doctor experts out there who are looking at the studies from primarily European and Asian studies, because we're getting data from there that's very patient oriented, and they're a little further down the road than us, and adding and removing things from the protocol based on what seems best at that time. But the low risk patients do less, but are really prepared in case they become sicker to basically increase the level of intervention for those patients. And what I'd like to do is, if there are any doctors out there who want that protocol, they can just go to my website and put an inquiry there. I will be glad to send them my typed out protocol. I'm happy to share it. I mean, obviously it's not to replace their own medical knowledge or medical expertise, but it's a starting place. So anything any doctor felt comfortable using from the protocols I've been using, I would encourage them to do so, with the same precautions. If the patient gets sicker, they go to the emergency room or call 911. So in the high risk group, a lot of patients don't know that they're high risk, which is a confusing part of kind of the lack of education, I think, coming from the sources where we're getting information right now. The patients that are high risk, of course, everyone knows that if someone's older, they're at more risk. But I've noticed in my patient population, it's not really age. It's really that people who are older have more underlying disease, statistically speaking. I have some very healthy older patients who've done great, who really don't have any medical problems. And my sickest patient was under 50 with undiagnosed, basically metabolic syndrome. And so the patients who have high blood pressure, the patients taking a lot of medications for cardiac issues or blood pressure issues, patients that are more than 30 on the BMI, which is a huge percentage of our population, they fall into that higher risk category. It doesn't mean that they're going to have to go to the hospital. It means that we might want to be a little more aggressive with our interventions to prevent progressing disease. So that's how I'm stratifying it. I'm looking first at, if someone calls and they're asymptomatic but exposed, I have a protocol for them to follow. If someone calls and they feel ill, we're encouraging testing, and then we're treating them based on their risk. And so far, so good. For the first 30 patients I've treated, I have felt that worked very well. I'm not trying to spend a fortune for the care of people. I'm trying to honestly find an inexpensive, practical, logical approach that people can do at home and help each other to do, even in their family members. I'd rather treat early and watch and follow than to not treat and wait and be afraid. I mean, that even provokes fear in me, to wait and be afraid that my patient might get so sick. These patients I've known for 20 years, some of them, like the last thing I would want is to wake up and find out that they were on a ventilator in the hospital. And I don't think I have to do that. I think I have tools to use to prevent that, at least good odds of preventing it based on what I've done so far. And I would just love it if other doctors would start doing the same thing. I think it would be a wonderful thing for the Texas population.
Yeah, and particularly that time frame between first feeling a little bad and being very sick can vary. At least that's been my observation with folks I know about that have ended up, unfortunately, in the hospital. It may have been, a week to 10 days between the time of first feeling bad and getting that sick that they headed off, and others just 2 or 3 days, almost seeming like almost overnight, going from just a little heavy breathing to really serious heavy breathing. So it's clearly a virus that affects people differently, and you do have to treat the individual patient with what you're observing when you see them in there. And so, but I think, and what we can do is we will put up your protocols when we put this together, so people have been able to watch them there. But I want to thank you so very much once again. Very glad that you could join us. Is there anything else that you would like to say to the folks before we work this thing towards a close?
I'm prayerful and hopeful that the word gets out that there's early intervention options for more people, so that we can start to get back to living. A lot of my patients are suffering right now with anxiety, depression, sleeplessness, stomach aches, and it's because they haven't really received that message that there are things that we can do that will help. And so if that, that would be the main message I would want to get out. And I'm praying every day that more people will resolve and heal after this virus so that we can actually move forward and get back to more of our normal interactions with each other, more hugs, more handshakes, more. And I hear people say that's never going to happen, but I feel like as resilient people and loving, caring people, we can get back to that. We just have to take care of each other.
You're absolutely right. And it just really bothered me when I hear that of people talking about, no more hugs, no more handshakes, and living social distancing. That is absolutely absurd to talk about that. But I feel that the only reason we're doing that is people still have in their mindset that there is no cure for this. There is no medical treatment. And if you get the COVID, you're going to die. And that's just what people have in mind with this. And as a result of it, though, what I am hearing in other places, or I'm seeing, is that the corollary collateral damage that we're doing to not just the economy, but to the health of people, to their mental state, their physical state, is deteriorating very rapidly. I know the incidence of suicides are up. The incidence of highway accidents are up, and highway deaths are up. We have a number of industries that people have, I've had this reported, well, it was over 6 weeks ago that we already have one airline that had 6 of their pilots committed suicide over the mental stress of the financial issue. And we've had others that with the hospital shutdown. Are you seeing patients that are coming in not for the COVID, but for stress-induced ailments that they feel a need to see you?
Well, last time I checked, which was a little over a week ago, we actually had more suicides here than we had deaths from COVID. And we don't normally have those kinds of numbers. So, I wouldn't want to erase the precautions that people take, especially if they're high risk. And I don't want to imply by saying the things I've said that certain people shouldn't be careful. But I think we've taken that, we probably needed to quarantine for a couple of weeks at the very front end to kind of get our bearings and get a plan and get together. And then it, to me, would be appropriate to let the healthy people start to intermingle more. And actually, my kids went to summer camp this summer. There were 200 kids at camp. Camp did everything they could to be precautionary, but the kids had so much fun. 2 of my kids went. We've had, more campers come out to the same camp. And, I don't want to jinx myself, but they've had a really great summer. I'm one of the camp doctors there. And, we've been careful, but we also see the benefit, like the long-term benefit of being outside, being with other people, learning new things, reaching new goals, spending time, becoming more independent. And to lose that, I think we just have to get practical, and we have to get some common sense logic and use it to make forward progress. And I feel right now we're kind of stuck. And so my hope from doing this today is to make some forward progress and become problem solvers instead of complainers. Like I teach my kids and I tell my staff in my practice, whiner complainers is being around a whiner complainer is like one of the worst feelings. But if you attach a solution to the complaint, now you've got a problem solver. Problem solvers are inspiring. they're put out good energy, like people look up to them. That's leadership. That's what I think you're trying to do, is find a solution to this problem. And we can do it one patient at a time. And as other doctors maybe get a little more confident, a little bit more um, independent thinking, and start to intervene on behalf of their patients more frequently, I think it will just grow from there. If we could just start with that, I think that would be a great starting solution to this problem. And then what comes of that would hopefully be some transition back to more normal interactions with each other, which we really need right now.
Absolutely. And I agree with your description there. One thing I would say that our problem is not having a medical solution. That is not our problem. Our problem is getting our government leaders to accept the fact that we have a medical solution and that we need to shift our strategy from just being on defense. We don't get rid of defense. We'll always need to have defense. But like any team, you got an offense and you got a defense, and both have a role. The defense keeps the other side from winning. Your offense is what wins for you. And so while we use our defense of our mask, our isolation, and where it's appropriate to be used, particularly among the most vulnerable, we put into play our strong offense to defeat the COVID with the medical professionals that are out there that know what they're doing, that we need to solve the problem of our government standing in the way of them doing what they do best, that is heal people. And I want to thank you so much for coming on and being here with us. God bless you in your practice. And I know we'll be staying in touch, and you'll be back to give us an update on what you find as you learn things that are new. We'll relay those to the people and to the other doctors out there, and look forward to seeing and talking with you at another time. So
Okay.
God bless you, and God bless Texas.
Thank you. Thanks for what you're doing. I appreciate you very much.